Hi everybody! Welcome back to my channel, A Fairy's Cancer Journey. I am Bree. If you are new here, welcome. And if you are a returning viewer, welcome back. I hope you are all doing well. This video is long overdue. I don't think I've put a video out since May. Don't quote me on that, but I'm pretty sure May was the last one that I put out. I completely pulled back on posting weekly and monthly vlog updates because my doctor appointments were all pretty routine. Like, they were kind of getting a little boring, and I didn't want you guys to get bored with my life and what's going on. There wasn't much going on at the time, but the whole summer went by. We're in fall now. It is like nearing the end of September, and I just wanted to give you some updates on my life. I do have a couple new things that popped up over the summer that happened to me that are cancer related, breast cancer related. I have a surgery coming up that we'll talk about, and just things I just want to update you on. Like, my hair is growing like a weed. As you can tell, I probably look totally different than I did in May. So I just want to say hello and welcome back. And if you're new to my channel, make sure you subscribe because I will be putting more videos out more frequently. I'm going to start working on that and committing to a schedule. I have a whole bunch of plans that I never ended up doing over the summer, but I do have plans to put more videos out and more content all throughout the fall and winter. All right, so let's get into the video. I'm just going to get right into it. The first thing I would like to share with you and talk about, in case you are worried that this may also happen to you, or if you already are experiencing this, if you had any type of a breast cancer surgery or had any lymph nodes removed in your axillary, this is a potential thing that will happen to you. Maybe, probably, don't know, probably. All right, so back in July, 4th of July weekend to be exact, there were fireworks going off in my town, and I was all excited to go, and it was extremely humid that weekend. And I had noticed a couple, I'd say months prior, off and on, I would get really like tired or stiff or kind of like a bruised muscle stretch. I need to stretch kind of a feeling in my arm. And now this is the arm on the cancer side where all of my lymph nodes were removed. I had all 19 lymph nodes removed during my first surgery, which was my bilateral skin-sparing mastectomy, because when they tested a couple of the lymph nodes during the surgery, more than half of them still showed cancer cells, and I believe it was 8 had tumor cancer cells in them. So my breast surgeon, just to play it on the safe side, removed all 19 lymph nodes out of my axillary armpit area. So that puts me at an extremely high risk for lymphedema. Now, I didn't have any lymphedema for the whole year and a half-ish after that surgery, but I did start feeling, before this happened, I'd say at least like 4 to 6 months, I was feeling off and on, not every day, not even every week. I would just feel like if I had to reach up and stretch to grab something above head level, I was a little sore. All down my arm, not just in the armpit. It was like elbow, definitely the hand, the fingers, like in between here, was real stiff and sore, like achy feeling. So I was doing stretching, thinking, oh, it might be axillary web syndrome. It could just be, I need to stretch because I have scar tissue there from radiation. So 4th of July weekend, it's super humid out. I'm sore. And I'm like, you know what? I'm just going to rub my wrist because it felt like my wrist, even just to bend it this way, the tendons were sore. I was like, what is going on? It felt like I threw a baseball 100 times in a row. Like, I shouldn't feel like that just from my day-to-day movements. So I rubbed my wrist. I gave it like a little massage. I was doing stretching. And then no shorter than an hour later, I have swelling and pinkish color to my skin, but in like random spots. I was like, is this lymphedema? And thank God, right after I had my expander placement surgery, long story short, if you have been following my journey, you know what happened. But if you haven't been following my journey, I had a skin-sparing bilateral mastectomy. When they went to take my port out, they thought there was an infection. There was no infection, but at the time during surgery, they thought there was an infection. So they ended up not putting the expanders in at that surgery. I had to wait a month to wait for the cultures to come back and see if it was an infection. Let's treat the patient, yada, yada. It was nothing crazy phenomenon. Ended up having a second surgery a month and a week later to get the expanders put in. Then I started radiation. So during radiation, I was also in physical therapy and I didn't have any lymphedema signs yet. So they had ordered me a sleeve and a gauntlet just in case it ever decided to flare up. I had the tools ready there to control the lymphedema swelling should it have ever happened. So I didn't have any issues last summer. I didn't have any issues during radiation. I didn't have any issues at all. Fast forward to this year, 4th of July, 2025, it started to swell. The humidity, me massaging my wrist, I guess, and overstretching, I don't know. Anything can cause it to flare up. That's the thing. You want to keep an eye out for it. So thank God, had this sleeve and this gauntlet, and I put it on. And I wore it. I made an appointment. It was on like a Saturday when this happened. So that Monday, I was like, I need to get into PT. I don't know what's going on. I might need a lymphatic drainage massage. Who knows? I don't even know if this is lymphedema. I've never had it before. So I made an appointment with PT, went to PT, and my amazing physical therapist, she's so cool. She knows her stuff too. She let me know that all of those off and on random achiness, feeling like I need to stretch, like some days I was fine, some days I wasn't, even just like reaching in the back seat to give my daughter something in her car seat. I was like, man, it was so sore. It felt like how you're stiff after having breast cancer surgery or just any type of breast reduction surgery. You get real sore in your chest wall and in your arm. It felt like that. And I'm like, what's going on? Like, I'm like a year out from surgery at this point, a year and a half almost, and it was hurting. Anyway, she said, those are the warning signs that lymphedema is coming, because lymphedema is a very slow process. You don't just wake up one day with an elephant trunk arm. It starts as like a slow drip in a faucet. So that's why I have this on. I wear it every day. This is the gauntlet. Just want to show you, this is to help control, because I was completely swollen. I will put pictures right here. I was completely swollen on the top of my hand, and I was swollen kind of like down to here, but just very sore, mostly sore in this bend area. Sore. I wasn't really sore so much in my axillary or up here. It was definitely just all the way down. Like, it was not comfortable at all. Wearing this, within a day or two, the swelling went down and I didn't have any more pain. Like, reaching up high didn't hurt, stretching outward didn't hurt. It was amazing. I was like, thank God I had this. So if you don't have a lymphedema sleeve or a gauntlet, especially, you want to do the gauntlet as well, which is the hand piece. It's a whole separate piece that you put on. You should definitely invest in one, even if you don't have lymphedema yet, because God forbid if it ever does flare up, you want to have the tools ready to beat that. You don't want it to get out of control to where you need a lymphatic massage. It hurts. Like, it feels, you're swollen. So your skin hurts, your tendons hurt, your muscles, your tissue hurts, because the fluid is stuck in there and the fluid's pushing against all of that. And it's uncomfortable. It's just completely uncomfortable. I don't know how else to explain it. It's not comfortable. So you definitely want to be prepared if you have had any type of breast cancer surgery, you've had any lymph nodes removed in your axillary, be prepared. Just even if you never get lymphedema, at least you'll have it ready, God forbid, if it flares up one day. So she advised that the humid weather is it was like a perfect recipe for this to happen. So the humid weather, the fact that I had been feeling soreness repetitively off and on throughout the last couple months, and then me manipulating it, massaging it too much. I mean, I wasn't rough with it at all. I was just trying to relieve the pain, but it got the fluid moving around. Anyway, she said, the fact that I was feeling this for a couple months means that the lymphedema had already begun. I just didn't know it, because it was the fluid building up in there and had nowhere to go, because there's no lymph nodes to drain it out. You have to massage it out or wear a lymphedema sleeve. These sleeves are designed they almost mimic the lymphatic system. So it helps to push the fluid where it needs to go, which is up here to the little lymph nodes that are left in my collarbone and chest area, and then get it to your stomach and bladder, get it out of your body. So that was update number 1. Now I have to wear this every day. There are some days where I may not wear it the whole day. For a while, I wasn't wearing the gauntlet. When I went to PT, she was like, it is killing me that you don't have your gauntlet on because, and I'm like, why? What? I already feel better with just this. And it's hard to do stuff with this on. You can't wash dishes. You can't wash your face. Like, you got to take it off. You can't really cook because you don't want to be touching like raw chicken or something with this on. Gross, right? So I was like, I'm not wearing it. I didn't know how crucial it was of a piece until I went to PT and she told me. But I'm sharing some information and knowledge with you just in case you don't know. She said, think of it like if you have a water balloon, like a long water balloon, and you squeeze the middle, because that's what this piece is doing. You're squeezing the middle of your arm. Where's the water going to go? It's going to squirt out this end and this end. So that's what's happening. She's like, if you only wear the sleeve, the water's going to go to your hand. You don't want it there. We want it completely squeezed to here so it can get to the lymph nodes that are available nearby and get that water out of your arm. So that makes sense. For a while, I was like, oh, you don't need the gauntlet. It's a pain in the butt. It's hard to drive a car with it because it's slippery. It's slippery, and I'm a right-hand driver. So anyway, just if you do get the sleeve and the gauntlet and you do have a lymphedema flare-up, if you're not aware of how lymphedema works, it's a very slow process. You don't even know you have it until you have it, and it's like, oh, you want to catch it early. You don't want to let that go because it's really hard to get it under control if it gets to like level 2 and 3, I believe is what she said. Mine, she's like, you caught it just in time. That's another thing during radiation before I even had lymphedema. Go to PT if you can, if you're able to, because she measured me a year ago. And then when this flared up, she measured me again to see like how bad is it. And mine thankfully wasn't that bad. And also a lot of the swelling had gone down because I had this. I was like, if I didn't have this and I just came to PT a week later, I would have had completely night and day measurements. So thank God I had this. But make sure you get like a baseline measurement as well while you don't have lymphedema. That way, if you do get lymphedema, your physical therapist or your doctor, whoever, yourself, you can compare size and measurements to see how bad it really is. The next thing I want to update you on, and a reminder for you too, if you haven't done this yet this year, go get your skin checked. We just had summer. I know you guys are probably all tanning and looking all beautiful and bronze, but I'm telling you now, go get your skin checked. Your whole full body. Go call your dermatologist. Pause this video. Call your dermatologist right now. If you don't have a dermatologist, go get one and make an appointment, because I'm telling you, skin cancer is so sneaky, and it's all cancers mostly are very sneaky. You don't even know you have it. Skin cancer for sure, it can be avoided. So just please go make your appointment with your dermatologist. So I go once a year to get my skin checked, especially after having had cancer. I just don't want to play around with that. Melanoma is no joke. So I had a couple spots throughout my adult life that looked suspicious, and I would either have them burned off, frozen off, or just biopsied, and then that was it. So I had this skin check, and I had a freckle that was on the back of my left calf. Now, I had something years ago on my same calf that came back as a hemangioma, which is not cancerous. It's just a cluster of blood vessels that get all like mixed up with themselves and create kind of like, it looks like almost like a wart, but it's a dark wart, but it's not. It looks like cancer. If you don't know what it is, it looks like a pencil eraser of dark pigmented skin, almost like a blood blister color is coming out of your leg. And it's very scary. Mine was like flaky and crusty. And I was like, oh my God, is this melanoma? It was a hemangioma. So anyway, there was a freckle near that same spot that had already been taken care of. And like they did a margin and everything just to make sure nothing could grow there. Yada, yada. That was years ago. So when I went this year for my skin check, the same freckle that's been there forever, hasn't changed. Just something looked a little bit suspicious to my dermatologist. So he had it biopsied. It came back mostly normal, but there were a few atypical cells in there. Great. So I now have to get an excision on that freckle or mole, whatever it is, just to rule out the potential chance that those minuscule atypical cells decide to turn into cancer. So that is scheduled for mid to late October of this year. same leg. I will take you along with me on that journey if you want to see it. It's probably not the most exciting. It's a little bit visually gross because there's a lot of granular tissue involved with the healing process of that. It looks like a bullet wound in my leg where they just take a big circle and they just take a margin and take out all the cells and tissue in that area just to avoid any cancer growing in the future. But yes, definitely please make sure you go get your skin checked. It's something that we don't really think about. And one part of our body that we actually don't remember even needs suntan lotion, because I forget all the time, is our ears. Because when we have our hair up and we're hot in the summer, if you have really short hair, if you're a male and you wear baseball hats a lot or don't wear baseball hats, you just have a short haircut, our ears are constantly exposed. So you can be getting sunburn here all the time and you don't even know it. You don't even know because you don't feel it's our ears. Like, who thinks about that? I don't. So definitely go to a good dermatologist that has a great rating online, has good reviews, or if you're comfortable, if you know for sure yours is like the best in the area, please have them check everything. Mine even checks in between the webbings of your toes, hands. He checks everywhere. He's so thorough. And he saw this freckle and he's like, I know you've had it, but it's just, I want to play it safe, especially because you've had cancer. So, and I appreciate that. Just another surgery. Great. The next thing I want to update you on is side effects of the endocrine therapy and targeted therapy medicine that I'm on. As you know, or if you don't know, if you're new here, you don't know, but if you have been following me, you do know, I am on a lot of hormone medicine because my cancer was hormone receptive. It is was ER/PR positive, HER2 negative. So it's estrogen receptive, progesterone receptive, HER2 negative. I had both breasts removed in surgery because I didn't want to run the risk of me having a second cancer later in life. Also, I'm all done with children and breastfeeding and all that, so take them. Take them away. I don't want them. It's not worth my life. So since so many of my lymph nodes came back positive with cancer, even after all of that chemo, and the tumor I had, I think I had 2 tumors. Yeah, 2 tumors in my breast. They did shrink, so they responded to chemo, but they didn't completely go away. So the fact that that was going on throughout the whole time that I was on chemo, you run the risk of any cancer cells traveling distant. So to avoid having a second cancer or like a bone cancer, ovarian, it's still considered breast cancer because it's the breast cancer cells that would have traveled distant. That's where it gets so confusing. Like, wouldn't this just be a new cancer if something popped up? No, it's still breast cancer. So to avoid that happening, I am on Arimidex, which is technically anastrozole. I take that 1 pill every single day for 5 years. I am on Verzenio, which is targeted therapy medication. I'm on that for 2 years. I take a 150 milligram pill twice a day. We'll talk about the side effects of that in a minute. I also go monthly for an injection of Zoladex, which is a dissolvable pill that is injected. It's technically an implant. It's injected into your, don't quote me on this, subcutaneous. I'll put the word here because I can never pronounce that, but it goes into your fat, basically, in your abdomen. And it dissolves over time. And I also go every 6 months for a Zometa infusion, which is a bone strengthener. It is zoledronic acid. Now, there are side effects to that as well. Knock on wood, thank the Lord above, I have not had the main side effect of that some people can get. It's very rare, but people do get it, which is necrosis of the jaw. I hope I never get that. The way to keep on top of that, if you are supposed to be getting a Zometa infusion and you're worried about that happening, go to your dentist, get a nice full cleaning, get a full mouth of x-rays. They can't really, I asked my dentist this, I'm like, would you be able to compare my x-rays from before cancer to being on Zometa and notice if there's any type of bone density changes in my jaw? And she said, no. You would need like a CT scan for that, like to see like the density of it. She's like, but we do keep an eye on it. Like, we'll be able to, she's like, you would know if you were getting necrosis of the jaw, it hurts. Like, you would have pain, like in your mandible, you'd have pain in your jaw. all where your teeth are. So typically you get like kind of a heads up from your body if it's starting. So just pay attention to your body. You got to be in tune with yourself. As soon as you get any type of cancer diagnosis, I'm sure you already were in tune with yourself to know something was off. Typically, a cancer diagnosis, if you haven't found a lump or a bump or had a symptom, you were probably caught by surprise. Like something came up in an image or just like a routine exam. That's where it would catch you off guard. But you really should try your best, if you're not already, in tune with your body. Like, you know when something doesn't feel right. Don't let doctors dismiss you if you have any awkward or unusual side effects going on where you're like, man, I'm just so tired lately and I'm normally not tired. Don't dismiss that, because that could be a sign of a blood cancer. If you feel a lump in your breast or your chest, even if you're a male, it happens to male too. Breast tissue is breast tissue. It's mostly common in women, but men carry estrogen as well, just a lower hormone level of it, but it's still in there. And cancer, the type that women get with the breast cancer, it's hormone receptive. So don't dismiss, if something feels off in your body, don't dismiss it. You know me, of all people, I'm a huge advocate for, please advocate for yourself. If you don't get the answer you want from one doctor, switch it and go to another. This is your life and this is your body, and you don't want to be dismissed as it's anxiety. Oh, lay off the caffeine. Oh, you could just be stressed out because, I don't know, you have a lot going on in your life. No, please listen to yourself. Please advocate for yourself. Okay, getting that out of the way. Sorry, I just always get so like intense and emotional about that, because I don't like when doctors dismiss patients, and then while you're being dismissed, if it is cancer, God forbid, it's growing and growing and growing while you're trying to get a second opinion. It's like, there's such an epidemic right now with cancer, all types, not just breast cancer, that we really should not be dismissing things that just might be stress. It might just be anxiety. It might, but let's take it a little step further here, especially if there's like a history of cancer in this patient's record, like maybe their mother or father or brother, sister, whatever. Don't take the chance. Please just be proactive. So the side effect of Zometa, the main one that you want to look out for is the pain in your jaw, for necrosis of the jaw. I thankfully, knock on wood, I'm actually due for my 3rd infusion, I think in November. I've been doing really well with that. I have no side effects anymore. The first one that I got, that day, I had chills. Like, it felt like I was getting the flu, but I don't have any side effects now when I go and get my infusions. So I'm very grateful for that. But that's just something to look out for. The hormones that I take daily and monthly, they come with a whole happy little bucket full of hot flashes. So that's pretty much like my main side effect that I've been feeling. I'm actually feeling one coming on now. It's all of a sudden, it's like I feel like I'm standing next to a heat lamp or in a sauna. Like I'll be sweating in places that I normally don't sweat ever, like forehead and temple. I'll be like, I'm dying. I need to stick my head in something cold right now. And then it goes away. It's like a minute or two, and then it goes away. And they're so random. It's not like, oh, I got my injection today and I'm having hot flashes. It's like, it's all over the place. So I can't even say like, oh, I just took my pill and that's why I'm having a hot flash an hour later. No, it'll be so random. It's so random when I get them, but they're hot when I get them. So that's the main one. Also, just like achy joints. Every once in a while, I'll have like a sore ankle one day, my wrist is sore the next day, my neck is sore another day, but it's never all at once. And it almost feels like arthritis, like I'm becoming a little decrepit old lady. But it's just a side effect of the hormones. It's crazy how your hormones can control so many different ailments in your body and aspects of your body. The other side effect that I get with the targeted therapy, Verzenio. We all know what comes with Verzenio. If you take Verzenio, you know. And if you don't, I'm going to tell you. And it is not pretty at all. It is diarrhea. And I don't get it all the time. I take this pill twice a day, every single day. I can control the side effects through my diet. Now, Verzenio, here, this is where it gets so crazy. You want to eat healthy to make your body as strong as it possibly can be to just in general, and to fight any future cancer or illnesses or germs or whatever that might be in your environment, right? But Verzenio does not like healthy. If you eat a salad or if you eat steamed veggies and you don't have a carb with it, for me personally, like if you don't have rice with that or a slice of bread or something carby or a banana, you're going to be on the toilet and it's going to be immense cramping. It's not even just like, oh, I have diarrhea. No, it is like before you have like the big explosion, it's like almost child labor level of pains, like not even hormonal menstrual cycle pains. No, it is like child labor level of pains. Like I get the chills. It hurts so bad, but it's not all the time. That's what's so weird about it. Like that's why I try to tell my mom, I'm like, she'll say she has something healthy for dinner and she'll be like, oh, I made this blah blah, do you want some? And I'm like, sure. Now that may or may not put me on the toilet later, but if it's really good and it's worth it, I don't care if I'm on the toilet later. It's so gross, but it is what it is. And I don't know. I'm just warning you now. If you have to take Verzenio, you can adjust the dose. I don't adjust my dose. My oncologist, she's so sweet too. She was like, if you need to, we can adjust it down to 100 milligrams or whatever twice a day or even lower. And I'm like, no, because when I do get, it's not every day. If it was like affecting my life and my overall quality of life, absolutely, I would want to lower that dose. Some people it does. It really depends on your diet and what you eat and how your body reacts to the Verzenio. But I'm okay if I'm going to have a Verzenio blowout, and it typically happens to me at like 3 a.m. I don't know why. I don't know why. I stop eating every day around 6 or 7 p.m. and I don't eat nothing again. And I fast a lot because of Verzenio and just because of the health benefits of fasting. But to keep the side effects subsided, I do fast every single day. I actually haven't even eaten yet today. And what time is it? Oh, well, it's early. It's 10:30 in the morning. But I typically will break my fast around 1 to 2 p.m. every day. And my eating window is till about 7 o'clock at night. And then I don't eat again till the next day at like lunchtime. And I drink a lot of water just for health benefits, but definitely also because of Verzenio. I'm trying to like limit the amount of food that goes in to limit the amount of blowout that comes out. If that makes sense. Sorry, it's TMI. So when I do have the wrath of Verzenio, as I call it, I will just take Imodium, and Imodium stops it pretty much immediately, like within like a half hour. So I'm thankful for that. But if you notice that you are on Verzenio, you're having blowouts all the time and total GI distress, like cramping and pain, like it hurts so bad, like knives, almost like a food poisoning feeling. If you've ever had food poisoning before, that's what it feels like going through. And it's like an hour of it before it actually happens. It's like, oh, and then it hurts and then it goes away, and then it hurts and then it goes away. And it's like going through your intestinal tract. If you're feeling that and you're uncomfortable and it's like messing with your quality of life, you're afraid to go out because you're scared that you might have a side effect of Verzenio, definitely talk to your doctor about lowering your dose. You can take Imodium every day. It's not going to hurt you, but in my opinion, I'm not a doctor, this is just my opinion, if I have to take Imodium every day, we got a problem. So I don't, thank God, but in the beginning I did for a little bit till my body adjusted to the dose of Verzenio. But if that didn't start chilling out, I would absolutely have my oncologist lower my dose for Verzenio. So if that's happening to you, it's a case-by-case basis. If you're really uncomfortable, please talk to your doctor and have him or her discuss your dose and lowering it. So the last thing that I want to update you on in this video, because it's already a long one, I didn't expect it to be this long, is my hair and just like my overall appearance. I'm sure I look totally different compared to what I looked like when I was like completely baby bird bald. I do have a video coming out soon that I'm still editing. I was giving it some time because I wanted my hair to grow a little bit more, but just to show what your hair looks like through chemo, like before you lose it, when you lose it, how long it takes to grow back, different hairstyles and things you can do while it's growing back, because if it does take a while, hair takes a long time to grow, and depending on your preference of what your hair looked like before you lost it. My hair did not look like this before I lost it. I was blonde with auburn chunky highlights and lowlights, and it was long. This looks nothing like what I looked like before cancer came into my life, but I'll be honest with you, I'm embracing my natural color. I like it. I have a couple grays coming in, and I call them highlights. I don't care that they're silver, and I don't have a ton, thank God, for my age, which is actually kind of crazy, but I'm very grateful. I was thinking I might put a couple highlights in, but we'll see. I don't know. I feel like I match my daughter's hair exactly too. Like when I had my blonde hair and auburn highlights and lowlights, like we didn't match, and now she's like, Mom, we have the same hair. I'm like, we do. Like we definitely look related now. Like just being silly, but with the blue eyes and the dark hair, she and I are like kind of twinning right now, and I like it. I'm vibing with that. But yes, my hair is long enough that it can get into a ponytail. I clip it up. It's so curly right now because it's very humid here in New Jersey. It's very humid. We're going through some random, it doesn't even feel like fall. It's very depressing. I love fall. But yes, it's getting so long, and it came in, if you remember, it came in almost like a Halloween clown bald cap where I had a bald up here and lots of hair on the side. So it's growing in that way. It was so awkward for so long. I had to do butterfly clips all the time or a headband, but now it's at the length where it looks like intentional layers. It's not. It just grew in awkwardly like that. Now it looks cute. So, and this is almost swooped to the point where I can actually put it behind my ear, but it falls out like all the time. We're almost there. But what I like about my length right now is I can blow dry it with the big round brush, and it looks so cute. Like it looks, I'll put a picture up here. I did a full blowout on my hair one day, and I'm like, I'm not hating this right now, but it's curly because it's all gone because of the humidity. Now it's back to its original roots, which is barrel curls. But yeah, that is pretty much the update on me. Oh, hold on real quick. One more. Lashes. So my eyelashes did come back after Taxol. They took forever, but they did come back. They came back half as thick as they used to be and half as long as they used to be. So as you can tell, I got some falsies on right now. I wear them underneath here, so it looks more natural at the line, the waterline, whatever you call it. I'm not a makeup artist by any means. So I put them on just to brighten my face and feel alive and feel pretty because my lashes are so little and short, and they're blonde, which is weird. So I have to wear mascara with them, or they don't even look like they're there. Oh, and my eyebrows, these are still drawn on as usual. But the hairs that came back, they just didn't make it. So I gave up on them. I just have to draw them all the time because the hairs that came back before I even lost my facial hair with Taxol, I overplucked in the 90s, and I already had like rainbow arch, skinny spaghetti, whatever the heck's there. They weren't even considered an eyebrow. So I didn't really have much to work with. And since all the hair that came back half of everything, it was like half the thickness, half the length, half the fullness. Brows also followed suit. So they're drawn on, and the lashes are here to just help me feel pretty and alive and cute. I like them, and they're easy to put on. So, but yeah, that is it for this video. It's so good to be back and see you all. I hope you all enjoyed this video. I hope you're all doing really well. I'm hoping my videos help you also in some way, shape, or form. I see that I am helping some people it's hard to like understand the whole algorithm of YouTube, but there are videos that like my whole journey that you are still watching, which is great. And I hope that you, unfortunately, I hate to say this, it's like, I hope that you are sending my video to people that you know who might be finding out they have breast cancer. I wish that wasn't even happening. I wish nobody needed to watch any of my videos because I wish cancer was cured. But if, God forbid, you know anybody near and dear to you that may have found out recently that they have been diagnosed with breast cancer, or they think they might have breast cancer, or you found out after the fact and they're now in the recovery part of their journey and they're getting ready for their expander exchange surgery, whatever part of their journey they're in, and you just found out and you feel like they need a little hope or inspiration, or just want to compare their journey to somebody else and feel like they can relate to somebody, send them my way. Send them to my channel. Hopefully there's a video that they can relate to, or maybe my personality they can relate to, or just to give them hope that, you know, life goes on after cancer. Am I in fear of it returning pretty much every day of my life? Sure. I mean, it's just human nature. You don't want it to happen. I'm trying not to manifest that happening, but could it happen? Sure, it could. But I'm going to live for today, and I want you to live for today, because that's really all we have anyway. I say that all the time. We only have today. Tomorrow is not promised. The earth could explode tomorrow, and we'll all be hanging out in heaven together. You never know. So we're going to enjoy today. Make the best of today. If today is just a yucky day and you don't feel good today, try your best to raise your vibration. You know what I like to say is put on some music, put on some makeup, put on your favorite shirt or outfit, call up your bestie, call up somebody you love. If somebody you love might be in heaven, close your eyes and talk to them, because they're right there. You know where they live, right in your heart. Okay, they're always right there. They hear you. Our loved ones hear you, and they're always with us. So try to just find something positive in every day to lift your spirits and raise your vibration. Just take things one day at a time. If you're finding out that you have breast cancer, you know, every stage is different. Everyone's journey is different. You're all different ages and different walks of life. But at the end of the day, we are all human, and we can only do our best every day and try to just stay hopeful and stay positive and love yourself and be proud of yourself that you advocated for yourself and you caught it. Whatever stage you caught it at, you caught it. And you're going to have hopefully a full recovery, and you're doing your best. Just take it one day at a time, one infusion at a time, and one hurdle at a time. All right. I love you guys so much. I'm so sorry I've been MIA, but I promise you'll see my face more often. I hope you have an awesome rest of your day and week ahead, and I better see you in the next one. Bye, everybody.